In this video series, I'm going to look at 10 tips when you're starting a new GP rotation or starting GP training. Now, when you're starting a new training program or moving to a new rotation, it can be really exciting, but it can also be really challenging. So here are some tips to help you. Number one, ask questions, ask questions, ask questions. When you change to a different specialty, or it might be a new ward or a new practice or a different department, there are going to be lots of things that are going to be new to you. Some of those things will be really specific to that place. For example, where do they keep that specific form? Where are the cannulae kept in this ward compared to that ward? Where do I go to send off the blood samples? Do they use a vacuum system? Do the porters come and pick it up? Does the ward clerk take it down for you? There's also meeting a new team and a new supervisor, getting used to a new consultant or a new GP trainer. And sometimes there might be some things where you feel a little bit scared to ask or a little bit embarrassed because you don't want to seem like you're not prepared. I think one of the big things, as someone who's helped many doctors over the years, I would much rather have someone who asks lots of questions, especially when you're new to the rotation, new to the team, than that thinks that they know it all and doesn't ask and then makes a mistake that could cause harm. That's much, much more worrying. And you only learn by asking things that you're unsure about, and especially when you're new to a specialty, remember that they're not expecting you to know it all. Yes, there'll be induction, but that will cover some things. There'll be some things that you just haven't encountered yet that you need help with, you need support with. So you could ask one of the doctors that's already been there longer, one of the registrars, for example. Ask your supervisor, your consultant, or your trainer if you're in GP. But there's also lots of other things that other members of the team can help you with. Okay, so just ask questions. That's how you're going to learn.